Good afternoon, and thank you all for tuning in for today's timely discussion. I'm Congresswoman Lori Trahan, and I'm thrilled to be joined by a fantastic group of guests today to discuss the Honoring Our Pact Act. When the decision is made to send our heroic service members into harm's way, we make a pact to care for them and for their loved ones, not just while they're deployed, but when they return home. Yet for too long, the federal government has been slow to respond to veteran claims caused by exposure to toxic chemicals during their service. This isn't a recent issue. It dates back to the Vietnam War when US soldiers were regularly exposed to Agent Orange, and it's continued over the years with exposures to airborne hazards from burn pits, radiation poisoning from atomic testing and cleanups, and PFAS contaminated water on military bases. Prolonged exposure to these toxins can have debilitating health effects, often years after a service member returns home to civilian life. Each day, more veterans speak out about their exposure to these hazards and their difficulty getting the treatment that they need. That's why President Biden called on Congress during his State of the Union address last week to pass a law to ensure veterans suffering from toxic exposures get the benefits and the comprehensive health care that they deserve. And that's just what we did in the House by passing the Honoring Our Pact Act. This bipartisan legislation that streamlines the VA's review process for veterans' toxic exposure claims and simplifies the burden of proof of exposure to airborne hazards and burn pits. It also requires the VA to conduct outreach and provide resources to toxic exposed veterans so that they know the new options available to them. There's nothing more important than upholding our promise to our veterans and service members who sacrifice so much for us each day. And that's why I was proud to vote for this legislation. And it's why we need to see it through the Senate so we can see the tremendous impact it will have on veterans here in the 3rd District and beyond. I could talk all day about how important this legislation is, but I'm fortunate to be joined by 3 local experts who can speak to the importance of the Honoring Our Pact Act to veterans everywhere. So first, I'd like to welcome Vincent Eng, Director of the VA Boston Healthcare System. Mr. Eng has served in this role for almost 10 years. An accomplished healthcare executive, he has a long history of serving veterans in the Department of Veterans Affairs. He's a member of the American College of Healthcare Executives, a graduate of Leadership VA, and has served on many Veterans Health Administration boards, committees, and special task forces, including being mentor in the VA Executive Career Field Training Program. Welcome, Mr. Eng.
Thank you, Congressman. My pleasure to be here, and thank you for working on this legislation that should benefit our veterans as well. We are really benefit for veterans. I'm honored to be here.
Great. And next, I'd like to welcome Coleman Nee, National 3rd Junior Vice Commander for the Disabled American Veterans and former Massachusetts Secretary of Veterans Services. Coleman also serves as the Chief Executive Officer for Triangle, Inc., a disability services provider serving Greater Boston, and he has over 29 years of governmental, not-for-profit, and private sector management experience. Welcome, Coleman.
Oh, thank you very much, Congresswoman, and we'd like to thank you personally on behalf of the DAV, Department of Massachusetts, for your important vote on this. As you've mentioned in your earlier remarks, we do not have a great track record on caring for veterans with toxic exposures. Going back even further to World War I, and it took a long time for veterans who were exposed to mustard gas to get their exposures, World War II and radiation. And then even in today, we still have veterans from Persian Gulf and K2 who are exposed to depleted uranium and other contaminants and still are fighting for their benefits. So we are really proud that to support the PAC Act. There's a lot of legislation out there, but we feel this is a comprehensive and far-reaching step that's going to help provide access to care and services for those who put their lives on the line for this nation, and really appreciate your support on this.
Well, thank you for that. And we're going to get into the crux of the bill and what it means for veterans in in Massachusetts and in our district. But last but not least, I'd like to welcome Michelle Moreno, the Veterans Commissioner for the City of Fitchburg. Michelle is a U.S. Army veteran and has served as a Veteran Service Officer for 18 years. She's been named VSO of the Year twice by the Massachusetts Department of Disabled American Veterans and the Massachusetts Department of Veteran Services. Welcome, Michelle.
Thank you, Congresswoman. Again, thank you for holding this. It's a very, very important topic at hand. I have to echo what Coleman said, and we need to do better by our veterans. Our service people go out, they put their lives on the line, and I see it on a daily basis. They come home, filing claims, getting denied. They deserve better, and we need to do better for them.
I couldn't agree more. And so without any further delay, let's get right into the questions because I know folks want to hear directly from you. So the first question, and it's for all of you, what are some of the issues that toxic exposed veterans face when they return home from service? And Dr. Ang, why don't we start with you, and then we'll just go one by one from there.
Okay, thank you. So good afternoon, everyone. So in the VA here at Boston and VA General, we've been doing a lot of work and research on toxic exposure. At Boston in particular, since we are a very active research institutions, we've been looking at toxic exposures like the belt wall, as you mentioned earlier, Congresswoman. So we have a lot of data, but we don't have a lot of data on burn pits. We're still working on some of the research. But what we see in terms of toxic exposure as the soldiers come home, there are some temporary symptoms like irritation of the eyes, breathing difficulties, skin itching, and asthma-like and bronchitis-like symptoms, and shortness of breath. But these are short-term symptoms that can be treated, and they kind of go away, and they may come back. But it's the long-term effect, and that's what this legislation is focused upon. It's a long-term effect that we have to work on. And we work on this not just for toxic exposure. We see a lot of conditions that the veterans has exposed to different environment, Agent Orange, that really, as research come to fruition, that this long-term impact really is what we need to do in the VA, and we are ready for it. So in this particular area, we urge veterans as they get out of service to enroll in VA. You are automatically enrolled for 5 years, and every veteran should take advantage of that. Right. And with toxic exposure, in particular burn pit, we have set up a link between our permanent service and primary care providers, that if any evidence or the veteran talk about toxic burn pit exposure, they are automatically linked to a permanent consult that we can begin to test it on the veteran. There may be a link, which is great. There may be some linkage, and there may be other things that we discover, then we can start providing the appropriate level of service. So the entry point really is to get a primary care provider, and they will manage your care, and they will link you to any specialist, pulmonary, cardiologist, if there's some cardiac symptoms, and we can start treatment modalities and help the veterans short-term as well as long-term.
Great to know. Thank you for that. Coleman, how about you?
Well, Congresswoman, that's very good information from Ms. Dang, and I appreciate that as a Persian Gulf veteran and as a patient of VA healthcare in Boston. So thank you for that. I think what a lot of our veterans, and it's not just veterans coming home, because there are, one of the things that we really like about the PACT Act is that it looks at toxic exposure regardless of where it happened. So it's not just for veterans who served post 9/11 in Iraq or Afghanistan or other places. It also covers many Vietnam veterans. It covers Persian Gulf veterans. It covers veterans who are exposed to radiation and various nuclear testing sites. And it also looks at the issues of those military bases where we know that there's been toxic pollution. And people have been exposed to things like drinking water and PFAS and all sorts of other issues. So, for those veterans coming back, they experience various health issues. One of the things that the PACT Act will do, it will grant a presumption of service connection for 23 respiratory illnesses and cancers, which, the science has been rapidly catching up to figure out are directly exposed. Or directly related to their exposure to those toxins. And it also starts creating most importantly, it creates a legal framework for treating these all in a standardized way, as opposed to the way in which we do it now, which is being treated from a VA benefit side. And I want to be clear to separate Mr. Ng he's on the healthcare side, but from the benefit side in terms of how people have to apply for various disabilities. And it could be a different system based on where they were and what they were exposed to. And some of those systems can be somewhat onerous. So we think that the standardization and creating this new legal framework is really going to do wonders for helping veterans to be able to make those claims and get the health care that they deserve and that they really need.
Terrific. And finally, Michelle, from your vantage point, some of the issues that toxic exposed veterans face when they return home from service and they contact your office?
Well, unfortunately, they don't contact our office until they've been home for a while. Mm-hmm. So I can't speak to exactly what they face as soon as they get home. It usually takes a while, and then they hear a lot of the horror stories about filing and people already being denied, and they come in negative saying, I know I'm not going to get it anyway. So a lot of times it's difficult even getting a veteran to file the claim. But once they do, I've seen too many of them come back denied, saying they have to prove where they were. They have to prove that they were burn pits there, that there were fires there. It's just too difficult.
Right.
As far as the Gulf War syndrome, part of that is they have a undiagnosed part of it, and you put in for undiagnosed with the symptoms that they list, and the VA will come back and deny it, saying you don't have a diagnosis, and it's contradictory, and they make it very difficult for the veteran to be able to prove their claims.
Yeah. Well, that's I know Coleman touched on some of this. So did Vincent. But just in your own words, how will the Honoring Our Pact Act help to remedy these issues and support finally our toxic exposed veterans? And we'll just continue in the same order if that's all right with everyone. Vincent, why don't you lead us off?
Okay. So I just want to preface my remark on the federal employees. So when there's pending legislation, I cannot endorse legislation. But what I can say in general is that this legislation, and I hope that there will be others as soon as that it will streamline the process for filing claims and claim for service connection, and then easy access to healthcare. I think that is pretty groundbreaking in terms of that area. As Michelle mentioned, veterans sometimes reluctant to file, and that VA may have certain bureaucratic process that make it more difficult. I think this legislation, from what I read, streamlined it, make it easier to get access to healthcare, which is my area of expertise. And I also hear about issues in terms of filing claims for compensation. Although I'm in the care side, if there's anything I can help, people should feel free to write me, and I can keep a conduit to assist in that.
Great. And Coleman, you already touched on much of this, but speak to why you support the PACT Act over some similar bills, such as the Senate burn pit bill.
Sure, Congresswoman. I think as veterans, we're just, we're very appreciative that these issues are even making it to the highest levels of Congress these days in both houses. But we've waited a long time for particularly for our Vietnam veterans.
Right.
And now that we're at the cusp, the PACT Act really is the most comprehensive bill. It's 15 bipartisan bills, which were formulated together. It establishes presumptions of exposure for veterans in various areas. It really, I think, is the most comprehensive in terms of establishing presumptive service-connected diseases. And the research component of it too, coordinating with VA and DOD to share data, making sure that, the standardized training for VA adjusters to as Michelle said, to deal with exposure disability claims, because right now, it's catch as catch can. You get, veterans will file claims with, one of our vet service officers like Michelle. She does an excellent job helping them to get their claims in. But, if the rater isn't really familiar with the standards for what toxic exposure is, one veteran could get granted benefits and another one could be denied. And that's, that's playing with lives. So we really feel like this is the most comprehensive piece of legislation on toxic exposure really that's ever been introduced in Congress. Veterans have waited far too long for this, from Vietnam and Persian Gulf and even our World War II veterans. And we should not make those veterans from today's conflicts, post 9/11 conflicts, have to endure that same length of time to wait. And by passing this, it will address all those issues under one comprehensive piece of legislation.
Yep, no question. Michelle, how about you?
Okay, I'm sorry. As I have to echo what Coleman said, and I can't keep up with all the intricacies, all the little pieces of it, and I have read over it. And one of the things I love is it switches from the healthcare 5 years to 10 years. A lot of the symptoms don't show up until further down the road. So the symptoms show up. I mean, they get home, they're busy with their families, they're getting back to normal life, and 5 years has gone by, and then they start having their breathing issues and whatnot, and they can't go into the VA. They've already lost their window of opportunity. So that extra 5 years is a big deal too.
Yeah. Great. Couple more questions, because one thing that we really are interested in hearing your perspective on is how the pandemic has exacerbated healthcare setbacks for toxic exposed veterans or veterans with other disabilities. Vincent, maybe lead us off again.
Okay. I have to say that through this pandemic, we worked very hard to make sure that any veterans that needed care are being taken care of. Not just at the Boston VA, but all Massachusetts VA and all the facilities. We have gone through 3 surgeries. The first one, March of 2020, the Delta one, and the recent Omicron. And for the first surge, we have basically closed down our operating room, no elective surgery, and that created a big backlog. And when that surge is applied, we try to catch up as much as we can. And when the Delta surge came, we had to redirect some of our resources and then build it up again. So the third surge, which is an Omicron surge, we learned from the past experience. So since the symptoms and the severity of people that get the Omicron COVID, the symptoms are less. We have less number of inpatients. We treat a lot more of them on an outpatient basis. We continue to treat the regular, non-urgent, elective type surgery in other conditions. Because we learned from the past, if you delay care, it's extremely hard to catch up. So our backlog now in the Boston area is really minimal. But what we see is that a veteran is sick or whatever conditions when they come to us, they are much sicker than before. So they need to be admitted to our hospital. We are at 50% census every day. We are full house every day. And it's really a burden on the staff, and I want to compliment our staff in the VA hospital of the great work that they are doing. But that's where we have the heaviest burden, is that as people come in, they are sicker, they need more care, and now with healthcare in general, the nursing home has less number of beds, and that we have a little tougher time of discharging patients to appropriate level of care. So that gives us an additional burden. But overall, we've been fine. There's a lot of challenges, including hiring enough healthcare workers, because everyone faces the same thing, just like the restaurant industry. But we are doing well. We have committed staff, but we do have some challenges.
Well, thank you for that. I mean, we are so grateful for, the work by your healthcare heroes these past 2 years. Coleman, how about you?
Yeah, I just and I really do have to thank Mr. Ring and the VA system for the way in which they handled the COVID vaccine shots and boosters. We particularly allowing spouses to be able to be eligible as well too, and that was a really great development, and I think that process went really well. For many of our veterans who came back with toxic exposures and have respiratory issues, I think Mr. Ring's absolutely right. I mean, these things made them exacerbated them, made them sicker. The isolation of being at home, having to do things over Zoom. Particularly some of our older veterans, aren't necessarily always all that technologically adept at doing things like Zoom and online applications. Even just our vet service officers, whether they be for national vet service organizations or municipal, a lot of them had to work remotely. A lot of them had to work, in places where they couldn't go out and do the outreach that they typically used to do. So it's taken a toll, Congresswoman, and I think as we're coming out of this, thankfully, if we pass the PACT Act in the Senate and it gets signed by law by the president, it's going to give us the tools we need to help us rebuild that network of care that we're used to providing to our veterans, and hopefully will allow us the opportunity to be able to offer them something that they've been long denied.
Yeah, that's motivation enough for us. Michelle.
You need to stop letting Coleman go before me. He's taking all my answers.
I know. You know what? That is a good argument for shuffling the deck. You get to go first next time.
Okay, so as like Coleman said, but I saw it a lot, not just the toxic exposure, but the mental health needs. And I know that's on a little bit of a different wavelength there. It was more difficult for them to get appointments, and as Coleman said, the elder vets, the calls that I got, they want me to do this thing on video, blah 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 blah. So but I have to give kudos to the healthcare system, because they did the best they could with what they had and how they could. I also use the VA healthcare system. And over the last 2 years, I haven't had any issues. I haven't been turned away. So for the most part, it was good. Technology has got to be the catch up with some of them.
Yes. Well, from my own experience, my father gets his treatment at the VA hospital, and he has MS. And so, while it was a bit of a learning curve to have those, initial telehealth appointments, thank goodness he was able to, still access his care and only come in when really it was, necessary. And so I know so many have dealt with the isolation and everything that goes with that. We're going to be dealing with that for quite some time, all of us in the community, certainly in the healthcare community, in the veterans community. But I think we do have some tools that we probably didn't deploy, more than 2 years ago that will help us reach more folks. Okay, so finally, this is an opportunity for you to describe, one, what your organizations do to support veterans, both during this time that we're living in, what resources you continue to provide, and also, most importantly, what's the easiest way for folks who are tuning in to take advantage of these resources. And as promised, although unfairly, Michelle, Coleman couldn't possibly take your answer away, but we will start.
No, he couldn't on this one. I'll give you that.
But we will start with you and go in reverse.
No, I do have to say, I admire Coleman. We go back a long way. So, well, as you know, I'm the Veterans Commissioner for the city of Fitchburg. And for those out there viewing, Massachusetts has a law that every city and town has to have a veteran service officer, a veterans representative. And that's what I do for the city of Fitchburg. So we're basically one-stop shopping for veterans. When you ETS, or even if you've been out for 30, 40 years, you have an issue, you need access to veterans benefits, whether you want to file a claim, get in the healthcare system, you're looking to get your certificate of eligibility to buy a house, education, all of it. One-stop shopping for veterans. You have to get a hold of your local VSO. Mm-hmm. There is on the Mass website a link to find your VSO. So you just put in your city or town and you can find out who your VSO is. So if you need services, any kind of services, you have any kind of questions, you're having issues with the VA, whether the healthcare, the federal benefits, whatever, contact your VSO.
Terrific. And we were so
Coleman.
Michelle took my answer. You could never steal my thunder, Michelle. Or I could never steal yours, rather. You're an amazing vet service officer, and I appreciate it. I think just from my perspective, I'm representing Disabled American Veterans, Department of Mass, and I'm also a national officer, and DAV is over 100 years old. We're an organization that was formed to help World War I veterans obtain their benefits and obtain their services and have the camaraderie to be able to support one another. And we've really could not be more proud to be a member of DAV, given the leadership position that they took on the PACT Act, as well as other issues that are in front of Congress right now, Congresswoman, and I know you're familiar with them and you hear quite a bit from their office. Yeah. But it is an amazing group. We are there, DAV.org. We're there to support our veterans. If you need claims filed, if you need assistance with transportation to medical centers, if you want to get involved from an advocacy point of view and help us to advocate and pass legislation and rules and regulations to improve the lives of veterans and our families, it's a comprehensive organization, congressionally chartered, and just proud to be a member of it, and really proud to be a member of Massachusetts, where our entire delegation voted for the PACT Act. And so thank you very much for all your support, Congresswoman. We deeply appreciate it.
Well, we appreciate you. Okay, Vincent, bring us home.
Okay, all right, I'll do my best. So let me first thank Coleman and Michelle for all their work in advocating for veterans. I've been around the VA. I have served on different states, but I can tell you Massachusetts is special. It's special because I don't know of any state that have mandated town agents for veterans. So that is really great for us in the VA to have that connections. When veterans need help, they can have easy access to local town hall to get the assistance. So I really appreciate that system that Massachusetts has. So a couple of things I'd like to share with you. So with the pandemic, we didn't stop improving ourselves and the service that we provide. So 9 months ago, we started a lung transplant program here at VA Boston. Only 3 in the whole country. So within 9 months, we have 3 veterans that received their lung transplant. So that is extremely good news. So we partner with Brigham and Women. We do the pre and post care, and we use the surgeon, which is also our surgeon, at Brigham and Women to perform the procedure. So it's great that we have such resource in the area, especially when we talk about toxic exposure. A lot of it has to do with the lung, your respiratory system. We are also focusing on taking care of veterans in their home. So, Congressman, you mentioned about telehealth, but we are physically going to veterans' home because Michelle talked about the isolation, veterans that may not be able to ambulate to a VA service center. So we are doing a lot more in veterans' home to take care of them. So we devote quite a bit of resources. We have a program called Hospital at Home. So it's not really real acute that require constant care, 24/7 care. We can treat you at home with visiting nurses every day and a physician and other supporting services. So your home is a hospital. Actually, it's great because you feel a lot more comfortable in your home, and then you are going to recover actually faster. So these are some of the because of the pandemic, of the change of the healthcare environment, we are adapting and we are innovating and we are doing our best to give access to our veterans much closer to their home. We are moving some of the specialty services to your area, Congressman. At Low, we have a subspecialty care there. At Bedford, we are staffing a lot of specialty clinics so that veterans only travel short distance to get their care.
Great.
So that's our concept, and I think that is working, and hopefully you will hear good things about it. So
Yes.
thank you for having me here.
Yes, no, well, thank you. Thank you all. I mean, that is all the time that we have for this afternoon. But I just want to say once again, thank you to each of our incredible guests for sharing their expertise with us. And of course, to each of you for tuning in. We heard a lot through this conversation about the tremendous impact the Honoring Our Pact Act will have on veterans in Massachusetts, in this district, and beyond. And if you think that these hard-earned benefits may apply to you or a loved one, please don't hesitate to reach out to our guests and their organizations for help. In the chat, we've included links directly to their website so that you or anyone you know who may be eligible can get in touch. So I want to thank you all again for tuning in this afternoon. Thank you to our wonderful panelists. Hope you all stay well and look forward to seeing you again real soon.